we've explained earlier that we can relax the restrictions only if the pressure eases off on the healthcare system. And as you heard from Minister Ong just now, the healthcare situation remains under pressure. To give a sense of what the system is like today, I'll share two indicators. One, nearly 90% of isolation beds have been filled. 90% of isolation beds in our hospital system have been filled. Two, more than 2/3 of our ICU beds are already occupied. So that's where we are with our healthcare system today. We are trying to add capacity, but it's not simply a matter of having extra beds or purchasing new equipment. Because as you heard just now, our medical personnel are stretched and fatigued. And while we are trying to reinforce the team, it will take time for these reinforcements to come in. And at the current situation, we face considerable risk of the healthcare system being overwhelmed. That means that we do have to continue with the stabilization measures beyond 25th of October for another month. It doesn't mean that all the measures will have to remain frozen or static throughout this entire month, because we will continually review the situation in the coming weeks to see if there is any scope for calibrated easing. And in instances where the risks are acceptable, in some of these settings or where there are measures where certain risks are acceptable, we will consider moving first on these measures. Meanwhile, MOF will provide a further support package to help all affected businesses and workers because of the extension of our stabilization measures. The components of this package will be similar to the earlier one. In other words, there will be a 25% job support scheme support. There will be a half-month rental relief for qualifying businesses, which will include your hawker and market stall holders. And there will be support for taxi and private hire car drivers. The cost of this package is $640 million. It's similar to the last round. And we will fund this package through upside in our revenue, like what we had done previously. We know this is a difficult time for everyone. In many ways, I would say this is probably the most difficult phase in our journey through COVID so far. But this phase will not last indefinitely. And in the meantime, we seek everyone's understanding of why we need the measures that we have today, and also your support to protect, importantly, our healthcare system and our healthcare workers.